stretcher. Great body mechanics. We also want to make sure we have our patient side rails up to prevent any injuries. Have a great team of personal support people to help when transporting the patient to the OR. We should always make sure that we keep our wheels in the lock position when we're transporting the patient from this bed to the OR table. We want to assess the patient, prepare the patient, choose the appropriate transportation. You want to secure the patient and be aware of all surroundings as you're coming to and from the OR room.
Okay, when transferring the patient, you need to make sure you have at least 4 people to help transfer the patient. We have the anesthesiologist, the circulator, and other people on each side of the patient bed. So the role of the anesthesiologist is to support the head, shoulders, and neck at all times. For the other 2 roles, they will be at each side of the patient, making sure to move the patient onto the bed correctly, and the other person will be at the feet and controlling the legs. The essential steps in completing the transfer of the patient is to have the stretcher right next to the OR bed with the wheels locked. One person must stabilize the stretcher while another stands on the opposite side of the OR bed to receive the patient. Safety precautions we must follow is to always use the right amount of people while moving the patient, and use good body mechanics, and apply a safety strap after putting the patient on the OR bed.
On my count, we'll go on 3. 1, 2, 3. Okay. Positioning of this patient who is undergoing total vaginal hysterectomy. So positioning a patient for surgery typically occurs after anesthesia has been administered. The primary goal is to ensure optimal access and visibility of the surgical site while maintaining the patient and staff safety. Additionally, proper positioning should allow easy access for administration
during IV fluids and anesthesia. Something to keep in mind are certain factors like age and medical conditions. When we're treating a patient undergoing total vaginal hysterectomy is in a lithotomy position. The arms may be placed at the patient's side and tucked in or placed on the arm boards and strapped down. Bring the patient. Bring the patient's operative side to the edge of the mattress, which we've done. Then attach the sockets and stirrups to both sides of the table and adjust the height and length as equally as possible, which we've also demonstrated over here. Each position can be adjusted based on the patient's specific needs. The choice of the positioning depends on the body areas that need to be accessed, the potential risk to the patient, and precautions required to prevent injury, and the surgeon and anesthesia provider's preference. To minimize the strain on the body, the patient should be slowly returned to the specified position after surgery, giving the body time to adjust.
The search tech will begin by performing a surgical hand scrub to ensure a sterile environment. Once completed, they will prepare the patient's skin using Ifador solution, specifically Providone iodine. The preparation will start at the pubic area using a downward motion toward and over the genitalia and perineum. Each pass will be performed with a clean sponge to prevent contamination. Any sponge used over the anus will be discarded immediately to maintain sterility. For patient safety, it is essential to allow the iodine solution to dry completely before proceeding. This ensures maximum effectiveness and minimizes the risk of irritation. And the tech will monitor the patient throughout the process and ensure comfort while maintaining an aesthetic technique.
Okay, when we start draping the patient's vulva, vagina, and inner thighs will be exposed during this procedure. We will be using either a one-piece lithotomy drape or 3 specialized drapes. 2 will cover the legs, 1 will cover the abdomen, and there will be a drape to go under their butt. Double gloving is also recommended during draping for the lithotomy position, as contamination is extremely likely. You will place the drape under the butt and unfold towards the floor. Make sure that your hands are always cupped whenever you are draping your patient. Use towels to outline your surgical site. For us, that will be the vulva. And one of the towels will be used to isolate the anus to prevent contamination.